Cardiovascular Consultants presents its Patient Education Series. Dr. Dennis Donahue discusses chest pain.
The topic for this session is chest pain or angina. Many patients ask what type of symptoms should they expect or when should they be concerned about various symptoms. I'll try to cover some of the symptomatology and give you some background. What we're talking about, of course, is chest pain caused by narrowing of the coronary arteries to your heart. This is the type of narrowing with cholesterol buildup that would lead to heart attacks. And we obviously want to find this diagnosis early before it leads to a heart attack. And these are signs and symptoms that you might have that, if detected early, can prevent you from having a heart attack. I'll start off by talking about classic angina. The location is usually in the middle of the chest, and the character is usually an intense heaviness, squeezing, tightness, or band around the chest is what most people describe. Sometimes this discomfort will radiate from that position. It'll radiate through to the back. Sometimes it'll radiate to shoulders. It can radiate down arms, particularly the left arm. It can radiate up into the neck. It can radiate up into the jaw on occasions. There can be exacerbating type of situations, and that's something we're always looking for. Classic angina is brought on by exertion and relieved by rest. Sometimes the exacerbating problem could be stress, up and down stairs, up and down hills. You may have been doing a usual workout and you found that you never had any symptoms, but now you notice with your workout you're starting to have this type of a symptom. Sometimes the symptoms can be atypical. The character can be more sharp. The perception of pain really depends on the patient personally as to whether or not they're feeling sharp pain or what the exact pain is. Some people are much more sensitive to pain than others. Some people have difficulty describing the pain. And a lot of times people have angina, they'll come in and they'll start going like this with their hands because they can't really tell you. And it's not something they've had before. Sometimes people will try to assign the pain to something else because they don't really want to have heart disease, and they'll call it something else. Not all pains that you have in your chest are angina. We find there are many other causes of chest pains that can mimic the pains I just spoke about, including gastroesophageal reflux disease or acid reflux. This is where you have acid come back up into the esophagus, and this can cause pain probably because of esophageal spasm. You can have gallbladder pain. You can have pain from the gallbladder that can go up into the chest. Sometimes it goes to the right chest. Sometimes it goes to the right scapula. It's another thing to be considered. One of the more common causes of chest pain that we see is musculoskeletal pain. We see it frequently as inflammation in the costochondral junctions, which are the joints between the ribs and the sternum. And that usually can be diagnosed by just touching the chest and finding out where there are areas that are tender. Another type of pain could be pericarditis type of pain. This is where you have inflammation around the heart, and that's a sharp pain. And that pain can be worse with a breath, and it can change with positions whether you're lying down or sitting up. If you ever feel that this discomfort may be angina or the beginning of angina, or it may be leading up to a heart attack, you need to contact your physician right away, or if it's really an emergent situation, you need to just go to the emergency room and let the emergency room figure out whether or not these pains are really a problem.
For more information, please visit our patient education page at www.cvcheartcare.com.